And then getting into today's session, I want to introduce or reintroduce everybody to Maureen Burke. She is the occupational therapist who is part of our practice here. And she has a big emphasis on aging in place, being able to stay where you're at safely as long as possible. She has been a collaborator with us here at Emory, but she also has collaborated a lot at the Georgia Tech School of Architecture and Design. And we're going to hear a little bit more about some of her expertise today. And again, be sure to email us if anything comes up that you're curious about after today's session. So welcome in, Maureen. I'm going to let you go ahead and pull up your slides for us. It's so good to have you with us this afternoon.
Thank you. Thank you so much. I am so happy to be here.
I know that talking about hands is something that's really important to you, but can you talk a little bit about why that's important for our, our members and care partners here at CEP? Why is this such a hot topic?
I think that if we just think about what we do with our hands every day and the regular daily activities that we would not be able to do, I think that says it all, really. And just little problems with our hands, whether can occur early on. It's not necessarily associated with mild cognitive impairment, but it is what we need to perform life, right? And with aging hands, most of us, including me, start to have some issues with joints. Can happen with the younger people, but just is it's something that's changeable. So if you know what you need to do, or if something's difficult, we as occupational therapists have modifications that can keep you independent. And so that's, I guess that's the importance, from being able to button a button to being able to hold a spoon effectively or chop an apple, drive, whatever it is. So, yeah.
Well, I'll let you get into today's presentation, and I'll be in the chat if anybody has questions along the way.
Great. It's really nice to be here. And let's just go ahead and move on to that next slide, guys. All righty. So we're going to talk today about just some interesting facts, some funny ones too, about our hands, how our hands generally change with age. Not a lot we can do about that, but we can do a little. We're going to focus a lot on arthritis, because that is a really big factor that can affect how we function. We'll touch on some universal design concepts. And then I have a lot of tools or devices, which I love to talk about, that will help make tasks easier. So our hands are very unique. We have 34 muscles in each hand, which is a lot of muscles when you think about that. We have three major nerves, 27 joints, and 27 bones. And so this information probably isn't that useful to you, but if you decide to go on Jeopardy or something, then this could be useful. We actually have 17,000 touch receptors. So what we can feel in our hands, from the light touch of a cotton ball, for example, to vibration, to being able to identify a sharp object versus a dull object. We can even put our hand not looking at a basket, say, and reach into a basket full of all different sorts of things and find the clothespin. We have that ability to determine what's there without using our vision, which is really pretty incredible. And I think this is why this area in hands is a specialty for occupational therapists and also for orthopedic surgeons, because the hand is so complex. They did a study. Love to quote a few studies, especially this one, because I think, how did they actually do this? But in our lifetime, our fingers on one hand are actually opened and closed or bent and stretched about 25 million times. So that's a lot of wear and tear on our hands. And then, of course, we know that we have a difference with apes and primates, because we have a longer thumb. And so we can perform this very fine tweezer pinch motion, which other apes and sort cannot do. So Osteoarthritis is something that affects a lot of us. Right now, CDC says 33 million, but with that number growing, right? And it's a disease that affects not just the joint itself, but the bones and the cartilage and the ligaments and the lining of the joint. So that's what causes, when things aren't operating correctly, that pain in the joint, the stiffness with moving, also sometimes swelling, or just that instability, which sometimes is felt more, in the knees and that sort of thing. So there are a few places that osteoarthritis makes itself known, and if you're 50 or older, chances are you've maybe felt this, or if you haven't, maybe in the next several years you will. The osteoarthritis is different than rheumatoid arthritis. So rheumatoid arthritis, I'm not going to talk about, but that is a different type of disease process, okay? Osteoarthritis, the experts don't like to call it the wear and tear on the joints, but it kind of is the wear and the tear on the joints. And primarily, we see it in the hips, the knees, the low back, the neck, and also the hands. And again, this usually is going to really start setting in around age 50. But if someone, say, was 15 years old and they had major knee surgery or shoulder surgery, it could show up much earlier. And this is a hand. You can see there's a little deformity there, a little bit of swelling, not too bad. Thought this was a decent example of what osteoarthritis looks like. And again, we talked about age. It's also caused by overuse. So this could be someone who performs a certain activity at work and has been doing that activity over and over and over. And so sometimes one thing that we think about, which we're not going to really discuss today, is carpal tunnel syndrome. And we know that that's associated with typing. That was typists, even before computers came out. We knew that overuse and repetitive motion was causing a disease process. As I mentioned, joint injury. So if there's an injury, there's more susceptibility to developing some osteoarthritis. The other risk factors are obesity and genetics. In women, I hate to tell you this, but we are more susceptible to this than men. And that's usually, it is because of the changes that occur in midlife, where the estrogen levels decrease in our bodies. And also weak muscles. That's why Megan was talking about exercise, and we had that coming up at the end of the month at CEP Live. It's very important because weak muscles just cannot support joints. And then when they can't support the joints, then that creates a misalignment, which is a little bit what we see in this picture here. Something that's very popular, probably the most common type of osteoarthritis in the hand, occurs right here at the base of the thumb where it meets the wrist. And that is because of the many movements that we do over and over with our thumb, reaching, grasping, holding different items. The general treatment here, you may want to see an OT, an occupational therapist who is a hand therapist, who could prescribe different types of exercises. Sometimes bracing is indicated to just give it a rest. Let that sore joint just rest for a little bit and not use it. And then hopefully teach you about activity modifications, how to still do certain things, but in a slightly different way. And then also the use of ice. So there are a lot of treatments that we can do for osteoarthritis, but as you see here, there's not a cure, except perhaps joint replacement surgery. If you would go through that, then we'd get a whole new joint put in. So we mentioned the likelihood of stiffness and weakness and pain. There can also be some small bumps that develop, especially on the hands around those little joints, and also some movements that sound really crunchy and crackly, and that's called crepitus. And usually it doesn't really hurt the client, but it sounds pretty bad. And that's usually seen more in the shoulders. Sometimes over the years, my clients have said, well, gee, I have this arthritis, and if I wear these little gloves on my hands, it helps it. And so that's fine. But I just wanted to emphasize there are two types of gloves, and they sell them all over now on Amazon. One is for heat, and the other is for cold. So either way, either you have it in the freezer, then put the gloves on and it cools the hand off and just makes it feel better, excuse me. Or also the others that you put in the microwave and warm up. You do have to be very careful with these and only allow them to be on your hand for 15 minutes at a time. That's really critical. Even in the clinics, we are very careful about covering with towels and layers of towels and setting the timer and rechecking the skin periodically, because some people are more susceptible to the heat or to the cold, or the hand itself is not distinguishing all of that sensation. So the person may think, oh, this feels great, but their hand is getting burned because their sensory system is not working at 100%. This is another item that a lot of people over the years have said that they like. This is called an isotoner glove. It's a compression glove, and it's sold like online, Amazon, anywhere now you can get them for arthritis. And people will swear by that and say that it really, really helps. And I believe them that it does, and it works for them. So I looked up a little bit of the research recently just to see if there was anything that definitively proved, right, that this type of isotoner glove would help. Not definitively, but it did have some mixed results. So I think that as long as if this is comfortable and it makes the client feel good, it is helping reduce swelling because it has that compression part of it. As long as the fingertips are not numb and blood is circulating, these are generally okay. But just be mindful of the blood circulation. So now we're going to just take a look at some ways to protect your joints and then really to preserve the function of your hands. And so, as I mentioned earlier when we were talking to Megan, there are, activities of daily living we do them every day, from turning on the faucet and doorknobs and clicks and plugging in our headphones and everything like that, where it requires a lot of fine motor coordination. And if a client has painful hands, it just makes life much more difficult. So my hope is to give you some ideas that can help you in your day-to-day. So here's a picture of 3 kitchen knobs. And the one on the bottom there obviously is the smallest, then the middle size, and then the largest. And the concept behind the items that I'm going to show you is increasing the surface area of any item to make it gentler on the hand joints. So for example, the tiny joint, the tiny knob there on the bottom is going to be very difficult for someone with painful joints to open and close. So the larger the surface area, the better manipulation there will be. And this is the concept of universal design, right? The use of levers. So with a levered doorknob, for example, a client can use their elbow to hit it, to open it, can also use the heel of the hand to hit it that way without actually having to use the small joints of the hand. The same is true with the faucet. You could use your elbow or the heel of the hand. That is, we would call that a modification of a task. A rocker switch is also kind of nice because the little switches are pretty difficult. So again, hit it with the elbow, hit it with the hand, and by doing that, you're protecting those little joints of your hand. A few clients have used this. To be honest, kind of mixed results. Some like it, some don't. It's a little attachment that can be placed onto a lamp to increase the surface area, increase the resistiveness, so it's easier to feel to turn on that lamp. So that is called a dynamometer. Now I will show you my favorite product of all time. I should call the company sometime and let them know how much I talk about Dyson, because it's a great material. Originally, it was used in the industrial setting in labs. It's a strong, rubbery, non-slip material. In rehab, we've used it a lot for many different purposes. And they have come out with 2 different types of jar openers. And one is for the small jars, as you see here, and they have a larger size that's used to open up a jar of spaghetti. It offers a tremendous amount of resistance, and it is much easier to open anything. My brother-in-law, who lives out in Missouri, was having trouble with that part of the thumb joint, right, that we talked about earlier. And he's like, yeah, every time I try to open this, that thing just hurts. So I sent Mike for his birthday, which was like within that same month, one of the small versions of Dyson, so he could open up tops without any problem and decrease any kind of damage to the joint, but also just to make life easier. Let me back that up. Don't want to miss any Dyson pictures. Let's see. Okay, so this Dyson comes in the jar openers, and they're on Amazon. Just Google Dyson jar openers or something to that effect, and it'll pop up. But they also sell this material in rolls, and also like placement style. So if you had an issue with something that you were using that was sliding, you could place that like a computer, if it was on an incline, place that item on one of these mats or rolls. It's really not ideal for using under a rug or something like that. It's more for smaller items. So maybe a paintbrush, or a pencil, you could wrap it around there if you had difficulty with your hand sliding off of it. And here is a picture of one of occupational therapy's favorite jar openers. I did a survey among our professional group, and this is the one that came up. It's an easy off opener, and it can be used one-handed. It does have to be installed, as you see, like underneath the cabinet, but it fits all sizes of jars, and even like little nail polish there, and has very tight teeth in there that will grab it, and so the turning is much easier on an arthritic hand. There's some other items that I thought you might just find interesting. This is a right-handled knife, and so if someone is having a lot of trouble holding and trying to chop vegetables or fruit, what this type of 90-degree angle does, it changes the forces to the shoulder. So basically, instead of using the tiny joints of the hand is positioned as you see like this, and we would be cutting this way. And so that is very protective of the small joints of the hand. It's sitting on a one-handed cutting board, which I want to show you. See the nails that come up from the bottom? This is where you could place your apple or onion, whatever it is that you plan to chop. You stick it on there, and it stabilizes. And then could use a various knife to cut that item. The little knife that's shown here that person is using is called a rocker knife or a rocker tea knife. They're decently sharp, but you could try that because it could help you. As far as water bottles, we're all carrying, including myself. Always have something around that's really too big for our hands. So this little attachment I saw on Amazon, and I thought it was great. It just fits on a bottle, and so you can slide your hand in, and again use the elbow muscle or the joint rather than squeezing the unit itself. And lift it up to your mouth. So again, that's a way of shifting from using the tiny muscles of your hand to using a larger muscle and joint. The other occupational therapists that I work with and I just love these Good Grips OXO items because they have a non-slip base, they have a non-slip handle. The handle is larger, right? So again, it's that non-slip, the enlarged surface to hold on to. And they're also really nice because if someone is not able to stand and look to see, hold the measuring cup up and how much is in there, you can look down on this. So sitting at a table and see where your measurements are. So you can really sit and bake or sit and cook with much greater ease. And we will look at another XOX example here. Again, all of these tools are helpful. They're rubberized grip, and the surface area is increased. So they're large, non-slip handles. I have several of these at home, and it really does make opening jars and peeling, scooping ice cream much easier. So that's the OXO. And then we move into these that look like OXO, but these are actually something that's a little more specialized in the field of OT for people who maybe are having difficulty with feeding themselves. And that could be for a variety of reasons. And so there are large handled utensils. like this, and the ends of them can be bent to whatever is suitable to that person. So you see this one is bent at a 90-degree angle, and this would be for someone who has decreased ability to move their wrist. And so they could hold the spoon like this, but the spoon is facing right towards my mouth. So you'd scoop and scoop this way. And so it really works well for some, no twisting of the wrist. And if you're interested, there are also long-handled combs and brushes. These would be more designed for someone who had trouble with their shoulders or decreased shoulder mobility altogether. So either pain or not able to lift their arms up. We usually say for shoulders, the functional range would be about to 90 degrees, which is what I'm doing right now. But as you can see, when you need to reach right and comb your hair, that's a lot more than 90 degrees. And so these items are very helpful to those who have that decreased shoulder motion. And here we have just universal handles. These are great. Again, the largest surface area, right, in the non-slip surface. And so these, as you can see, you can put anything in there that will help you hold a toothbrush or a razor, a pen, a utensil, anything like that. These are great. So this is called a universal handle. And again, you can search that on Amazon and you would probably find many more than just this version available to you. Many of you know that I do enjoy gardening, so I want to make sure I include some gardening devices. This is a gardening trowel, which again offers the wrist support and allows a person to use the larger joints of their arm to work in the garden. And this is actually called a multi-grip trowel. And this particular one is made by a company called Roam Wild. And Fiskar scissors are another, Fiskar in general has been very sensitive to people with weaker hands and joint pain. We actually do a blanket making class here at CEP where we make blankets, so there's a lot of cutting, and then we donate them to Children's Hospital around the holidays. And so we have many of these that our clients use during all of that cutting. Because that cutting is right, that repetitive motion. And we are doing a repetitive motion. And so this is very helpful. You put your hands on the outside, very protective of the joints. And then the gardening tools are similar. Again, that same concept of increasing the size of the handle and adding a resistive surface. And driving is something that maybe some of us don't think about, that how much that could potentially affect arthritic hands, because it's that sustained movement, right? And when you have arthritis, it's good to kind of stretch and move them to keep things flexible. And so what we have here is a picture of a guard that goes around the steering wheel that's larger, again, larger surface area and resistant. And so that's what this is. It's a cover for the steering wheel. So this one I found on activehands.com, but I think you could find whatever type you desire. Again, on that favorite store of Amazon. And these are fun. These are called key wings. Again, a lot of varieties out there, so I just picked these. So turning a key in a door with an arthritic hand or with a weaker hand or with an older hand can become really difficult. And so you just add this little attachment onto the key, and it, again, increases the surface area and makes it rubbery and easier to grasp. And I also like the color. I think they look really nice. So that is pretty much all of the little pieces of adaptive equipment I'm going to talk about for the moment. I want you to just shift over to exercises that we know are very good for people with osteoarthritis, and that's the water. The water is very gentle on the joints, and so swimming or exercise classes in the water are wonderful, very gentle. Also, I'm including Tai Chi and yoga. I know that Megan is obviously a master at yoga, and she, for example, would be able to guide a client through the proper movements without hurting themselves, but would still be able to get the benefit of a yoga class. So there are many more items out there that I didn't include, but you could look specifically at the Arthritis Foundation, or pull them up on your computer and save that link and just kind of follow them and see what they have to say. And there's also another group called the American Arthritis Foundation. So either of those would be great places to just kind of keep up on what is going on as far as arthritis and cures and research and advice and suggestions. They have a lot of great material. If you or your loved one is having a specific urgent issue right now with arthritis, and you feel that you would benefit from having a few sessions with the therapist, you could ask your physician to refer you to a hand therapist. Sometimes, mostly, you may get a physical therapist or an occupational therapist in that case, but it is a certified hand therapist, and they are excellent at being able to give you an exercise program that would work for you, and also suggestions on how to adapt your lifestyle to reduce the strain and stress on the joints that are giving you a problem. And we do have some references here, and I will close this out now.